Welcome to Cancer 101, an educational program especially dedicated to the African American community. Here we are in Module 6 of this training, and we have now reached the part where we discuss the basics of cancer treatment. There are three approaches to treat cancer: the conventional or Western medicine, focused on using medications and radiation to kill the cancer cells in the body, and the complementary or alternative medicine, focused on using natural remedies and healing processes to restore the harmony of the body and life. However, some people use the holistic approach, a blending of both the conventional and the complementary therapies. Under the conventional or Western medicine, treatment options are based on the type of cancer, the size, location, and stage of the cancer, as well as the general health of the patient. There are two types of treatment for cancer: local treatment, such as surgery and radiation therapy, affects the cancer cells in the tumor and the areas around it. Systematic treatment, such as chemotherapy, hormone and biological therapies, and stem cell transplants, affects all the cells in the body, regardless of where the cancer is located. We will explain these treatment options in more detail next. Surgery consists of the removal of the cancerous tumor. It is effective in treating cancer that is localized or has not spread beyond its original site. Radiotherapy consists of exposing to radiation the area where the tumor is located. The radiation can be external, like being exposed to X-rays, or internal, where the radioactive substance are implanted in the tumor. Radiation in high doses kills cancer cells or keeps them from growing and dividing. However, radiation also kills healthy cells. This is why doctors carefully limit the doses of radiation and spread the treatment out over time. Chemotherapy is the use of drugs to kill cancer cells. Cancer drugs are carried by the bloodstream through the body to attack and kill cancerous cells. These drugs can be given intravenously, orally, through an injection, or topically. Hormone therapy consists of taking special medications to kill cancers that are dependent on hormones to grow, like breast and prostate cancer. Because the cancer cannot grow, it can be controlled for a period of time or even go away. Biological therapy, also known as immunotherapy, consists of the use of living organisms or genetic materials to fight cancer. In this therapy, bacteria or vaccines are used to stimulate the body's immune system to destroy the cancer cells. But what is the difference between biological therapy and chemotherapy? Well, biological therapy and chemotherapy are both treatments that fight cancer. While they may seem alike, they work in different ways. Biological therapy helps your immune system fight cancer. Chemotherapy attacks the cancer cells directly. Stem cells are cells that have the capacity to divide themselves, creating new cells. They can also transform themselves in any kind of cell that the body may need, such as a muscle cell, a red blood cell, or a brain cell. As we explained earlier, chemotherapy kills cancer cells, but also kills healthy cells. Stem cells are very important because they can restore the healthy cells affected during cancer treatment. Sometimes patients receiving high doses of chemotherapy or radiation need stem cell transplants to increase the body's capacity to receive more treatment. In these transplants, patients usually receive stem cells from their siblings or parents, but other donors may also be used. The side effects of cancer treatment occur due to damage of healthy cells and tissues. In addition to the cancer cells, chemotherapy is known to have the widest variety of side effects, which may include hair loss, anemia, tiredness, weakness, poor appetite, nausea, vomiting, diarrhea, mouth or lip sores. Surgery may cause pain, and radiation may cause tiredness and or skin changes. Biological therapy may cause flu-like symptoms, and hormone therapy may cause weight gain, hot flashes, and nausea. Considering the negative effects of the traditional treatments just explained, or their limitations to cure cancer, some people with cancer prefer the use of complementary and alternative medicine, CAM, such as acupuncture, massage therapy, herbal products, vitamins or special diets, visualizations, meditation, and spiritual healing. Some types of CAM may change the way standard treatment works, which could be harmful. Other types of CAM could be harmful even if used alone. It is highly recommended to discuss your treatment options and preferences with all your healthcare providers, including spiritual and non-conventional healers and advisors, to be sure that there are no negative interaction effects between all the therapists chosen. Patients preferring CAM therapies need to be aware that some of these therapies may not be covered by your insurance. Palliative care is the care given to help patients cope with symptoms of cancer or side effects when there are no more options for cure. It is also known as comfort care, supportive care, or symptom management. The goal of palliative care is to prevent or treat as early as possible the symptoms and side effects of the disease and its treatments. In addition to the related psychological, social, and spiritual problems, every person is different. For example, difference in age, cultural background, or support systems, in addition to types of cancer and treatment, may result in very different palliative care needs. Research shows that palliative care and its many components are beneficial to patient and family health and well-being. Patients who have their symptoms controlled and are better able to communicate their emotional needs have a better experience with their medical care, and the quality of life and physical symptoms improve. It is very important to know and understand very well the needs of the patient and the family when defining the palliative goals and plan. Now that we have been over Module 6, you may understand common cancer treatments and their potential side effects. Please join us as we conclude our training program in Module 7, where we will discuss cancer research and ways that you can help.